Good morning, everyone, or afternoon or evening, depending when you're looking at this. My name is Chrissy Reichert, and I'm going to be talking about three very important concepts: telemedicine, patient education, and healthcare literacy. How these things are independent, but also how they intertwine and interact to make one big concept. So, are you ready to get hitched? The first concept we're going to talk about today is healthcare literacy. One of the studies included in this review from Sudor et al. Described healthcare literacy as the degree at which individuals have the capacity to obtain, process, and understand health information and the services needed to make appropriate health decisions. It's shown that somebody, as a decrease in health literacy, so the ability to understand, it increases in ER and hospital visits because they're unsure of what their disease entails. It's more commonly associated in older populations who experience chronic health issues, lower socioeconomic status, race, and sex differences. Chronic health issues are often more complicated and very complex in their language. And so those older individuals who have these diseases, such as like diabetes or arthritis, tend to have a lower understanding of what's going on with their own body. Gaps in understanding can be attributed to lack of communication, mistrust of the provider, intimidation or fear of asking questions, or just misunderstanding, and low self-efficacy with understanding the whole healthcare system. The second concept is patient education. Basically, this is making patients and families aware of what they're being asked to do, why they're doing it, to clarify misunderstood concepts, and to provide feedback about their care. It requires education or educating the patient, behavioral or multi-component strategies for understanding. So, educating the patient or helping them go through the steps and processes of giving themselves medications or making them aware of their body and what to watch out for. A long-term goal of patient education is you want to allow the patient to care for themselves. A lot of the times when you're in a hospital, a nurse or a doctor is constantly monitoring you. But when you're discharged, you are left to do all of the decision making yourself. So, one way to really help achieve a lot of that self-care is through advances in technology. Patient education does involve appropriate language and things that help the patient really truly understand. A lot of that can include highlighting visual cues on brochures, lists with bullets or numbers. Make sure there's a lot of white space so it's not overcrowding and a lot of information can be overwhelming. 10 to 15 word sentences, words under 3 syllabi. Leave blank spaces for customization. So if they're having to take a certain amount of medicine, leave that blank space so that you can customize it and they feel like their care is individualized. And stay on a 5th or to 6th grade reading level. A lot of times people that are in a 12th or above grade reading level won't be offended with simpler information. But the last thing you want to do is send a patient home with a brochure that they don't understand. So these are all great concepts that can be incorporated to increase patient education. Now, telemedicine is the last concept we're going to be talking about, and that's virtually communicating or monitoring patient status to promote disease management, patient healthcare, and interprofessional collaboration. So basically, distance healthcare. It enables patients to care for themselves a lot of the time too. So not only can the doctor care for you when they're not around personally, but also it helps patients to really care for themselves. Another concept for that self-care. So in a specific article in this assignment, they were talking about web monitoring of blood pressure. So the American Heart Association created Heart 360, which was a web-based program that allowed the patient to help monitor their own blood pressure. And it did show a decrease in people who did not take their medicine accordingly, which is good. They also have Bluetooth and Wi-Fi based glucose monitoring for diabetic patients. So a lot of the times the glucometer and the insulin pump is hooked up to your phone, and so when your insulin levels get too low or too high or glucose gets too low, it sends an alert to your phone and also sends an alert to your primary care physician. So a lot of the times that is your athletic trainer or primary care provider. So a lot of the time that can be your athletic trainer, but it could also be a doctor or even a family member to warn them that their sugar is low. And it does require patient education because when I said earlier, patients are discharged, they no longer have a nurse or a doctor monitoring them 24/7. So telecommunication, or excuse me, telemedicine is a great way to enhance communication and also a great way for a patient to provide their own care that is more cost efficient, less trips, and helps promote a healthier lifestyle. All right, so now that we've talked a little bit about them individually, let's talk about how they're connected. And, well, let's get hitched. So how are all these connected? So let's start with patient education. Educating our patient is a very huge part of what we do. They need to understand what it is they have or what condition they're dealing with and how to deal with it. And I think that plays right along into healthcare literacy. If you can educate your patient properly, then they're better able to understand what you're saying, and that increases their healthcare literacy. Therefore, hopefully, we can decrease the amount of times they're in the ER or the emergency room, and they'll increase in their self-efficacy in how they view or how they understand the healthcare system. In conjunction with that, we have patient education playing a very vital role in telemedicine. If you educate your patient appropriately, you can send them home and perhaps they can monitor self-care. And that's where telemedicine comes in. Being able to monitor your blood pressure with the American Heart Association app, or monitoring glucose using the Bluetooth, or just talking with your provider over the phone or over FaceTime if you have a question. But part of healthcare literacy is understanding what to ask and when to ask it. And so all these three things are connected. If you educate your patient, pardon me, they're more likely to have healthcare literacy. When they have healthcare literacy, they know what they can ask and they know how to ask it. And telemedicine provides that avenue in which they can ask those questions without having to make cumbersome trips to the doctors back and forth. So I hope all of this made sense to you guys. I found them to be very, very cool and very connected. Here are the resources and the articles in which I discussed. And I hope that you guys learned something because I definitely did.